Hi, I'm Emma and this is Dan, and we have come together today to answer some of my most asked questions by my followers around my dental work. Is Turkey any good for teeth? Is the UK better? Stick with us and let's see what we asked Dan. Okay, Dan, are you ready for the questions?
Yes.
Glasses are on, I mean business. How do you pick the right practice for you as a person?
So we are talking today about potential patients who potentially might consider treatment when they are, let's say, if they are decided to go abroad for their dental treatment. If it's Turkey, some of the patients we've seen going originally where I'm from Romania or Poland or Hungary. It's another destination for teeth. Obviously, you're going over recommendations. You're going from friends, from their recommendations, if they had treatment done, how they will rate the clinic, if they have any problems, how responsive is the clinic in case if it's a problem. Obviously, nowadays most of the patients, they are tending to go to practices in Turkey. It's obviously it's difficult for us to compete with the practices in Turkey, primarily from the point of view where the overheads are coming into play. Their inflation is through the roof. So obviously the salaries are a bit lower, and that's why the prices are way lower than the UK prices. And unfortunately, we have to address the issue that sometimes they are concentrated more on the volume, more on the quantity, and maybe the quality sometimes is maybe falling into the second or third priority for them. But yeah, going back to your initial question, if you have to pick a right practice, you have to do your research properly. You have to spend more time chatting with them, sending them emails, asking them for cases that they treated, something similar to what you have.
So I'm going to state here, don't just follow someone where they say to go online. If you see an influencer or someone saying, I've been here, get your work done, look at mine, back it up with a bit more research yourself and ask some questions.
Exactly. Because obviously we have to be honest, in case where the patient is the image of the practice is going to be looked after, and obviously they because they are they are part of the image of the practice. Any problems they will have, they will be dealt within minutes or seconds, and they will get the response from the practice and the treatment and stuff like that. Obviously, if you're on a tight budget, it's going to be a bit more difficult because obviously you have to consider flying over in case of a problem or something like that. So you have to do your research quite well, and obviously you have to go from friends' experiences. So from
Can I just ask a little off the cuff question on this? Do many people come into UK dentists for a consultation to see what they actually need before they go to Turkey? Because does it happen? Because my situation was, I went to Turkey, I got and they priced me for something I didn't even need doing. So if you had to guess a percentage, is it not very high of people who do the research before?
We do get a lot of patients who come over because usually most of the patients who are asking about the radiological examinations where they are being referred from practices in Turkey to have a form of an X-ray, like a full mouth X-ray or a 3D X-ray, in order to assess, for them to send that image to the practice in Turkey to get more of a accurate price and stuff like that. Obviously, sometimes patients are asking us about the prices. Some cases are, we have some cases where patients, they decided, oh, you know what, rather than to go ahead with the treatment in Turkey, I'll stay with you guys because you're local. But again, you have to do your research. But sometimes it's quite difficult because when you have a lot of options of practices in Turkey and everything looks appealing and everything looks like nicely polished, it's hard to make a decision.
It is. It's very aesthetically pleasing, the clinics over there, which can woo people in.
It can lead you to a false sense of security when you see everything shiny and stuff like that. But obviously you hear some of the stories and you're a bit more apprehensive and stuff like that. And yeah, it's just a case where you have to be very aware of potential problems.
So, second question, what is the difference between veneers, bridges, and crowns? Because I was totally at a loss around this.
Yes, and a lot of patients, unfortunately, they are misled to think that the veneer is the same thing with the crown and is the same thing with the bridge and stuff like that. And obviously Google will give you some explanation, but I think the best explanation will come from a dental professional, a medical professional. So the veneer, if we'll try to imagine a false nail, so it's exactly like applying a false nail, so it just goes on the front of the tooth. Nowadays is very popular, the treatment composite bond, known as composite bonding. It's actually veneers made out of composite chair side, so the dentist will actually create that facet, create that veneer out of composite. So that's a more rapid way to fix, to improve the appearance of the tooth, the shape of the tooth, the length of the tooth, the color of the tooth. You can enhance a little bit the color of the tooth. Obviously, it's a very time-consuming process. We emphasize more in using porcelain for this kind of treatment for the veneers. The veneers are individuals, so you can't hear about...
Can I just ask, just a lay person who really doesn't know dental treatment, is that the one where they shave your teeth down? Because...
Yeah, so it's a very valid question. So the shaving of the tooth, with the veneer, with a conventional veneer, you have to reduce a bit the tooth to allow the material. If you don't shave the tooth at all, that means the veneer has to be added on top of your tooth. So if your teeth are sticking out quite a lot,
there will be... that's where people make them comments about horse mouth and things like that. Yeah,
exactly, because your teeth will be something added in front of. So try to imagine your nail. If you add layer after layer, you're going to end up with a big, thick nail. So it's the same with the tooth, and that can create problems with the lisp, can create problems with the phonetics, can create problems with the way that your lip folds and the way that you're closing your mouth. So with the veneer, you can do a minimum preparation. We call it minimal or to non-prep veneers, where you barely touch the tooth and you create a shape where the porcelain facet sits, but it's just on the outside. With the crown, you have to shave down the entire tooth. So it's a 360 preparation where you shave down the tooth completely, and then the crown surrounds the tooth. But the crown and the veneer, they are individual items. So they are separate to each other. So if you have 10 teeth, you'll end up with 10 crowns or 10 veneers that will be cemented individually. When a bridge appears in the discussion is where you have a gap, and that gap, the dentist and the patient, they both agree not to replace it with the help of implants, dental implants. And in that case, you prepare the adjacent teeth on one side and the other one, and you bridge across. So there are multiple crowns joined together that sit on 2 teeth on each side. So if you don't have a tooth for the back, you can't have a bridge because you don't have support.
It's got to connect from what it's got to be like Lego. Yeah.
Exactly. And unfortunately, the bigger the span between those teeth, the materials can differ. So, for example, if you have a big span, you need to have reinforcement with titanium or metal inside of that bridge in order to sustain all the forces. If it's a smaller gap, you can go for a zirconia bridge. Yeah. But unfortunately, we've seen cases coming from Turkey where the patients were told that they will get individual veneers or individual crowns, and they came back with bridges. So teeth all joined together.
So telling them one treatment, this is what you've heard, and then you get another. So my case was with Turkey, exactly what you've just said. They wanted to shave all my teeth down and put crowns on. Now, as you know, you've treated my teeth. I've got relatively healthy teeth that do not need shaving down. So that was what put me off going to Turkey, was you're offering me a treatment plan that I don't believe I needed.
And probably you're being told that you're going to end up with crowns, but actually what was happening, you're getting fitted bridges. Because from manufacturing process, it's faster to do a bridge than a crown. Because the difference appears when you do individual crowns, you have to be mindful about the gaps between the crowns. If you have a bridge, you don't care anymore. You just, the technician, the dental technician in the software will just deal with that, will just create a separation, a digital separation, and that's it.
So in relation, I'm assuming someone's dental plan is very individualized to them. So you wouldn't say veneers, bridge, or crowns is better. It depends on the person's teeth.
Or nothing.
Yeah.
Sometimes nothing. Yeah. Something as minimal as just align them a bit with some retainers for a few months. Now, used to be a very popular brand, Invisalign, that was capturing the market. Now there are tons of brands. The market is already more competitive, so you can get this kind of expensive treatment or something like that, the more affordable prices here in UK, because obviously there are different brands on the market that they are offering this kind of solutions. So having more competitors, that means the price dropped, and obviously you can get something a bit more affordable. And again, just a minimal preparation, maybe some composite bonding or some very small touch-ups. Sometimes when it's a big job, the big jobs require a lot of time.
Yeah.
Because we're working with the human body, we're not working with brick and mortar. So even brick and mortar needs time.
It's a lengthy process, isn't it? Yeah.
Exactly. So even brick and mortar requires time to set. So obviously, when you're dealing with gums and teeth and the whole apparatus that holds the tooth in place, you have to be very mindful and you have to follow it and to see exactly how it will progress. Having something done very fast will end up to very fast repair work, going for repair work.
Brilliant. My third question to you, Dan, is probably the most important question, I think. What happens if something goes wrong in Turkey versus if something goes wrong in the UK?
Yes. So obviously in UK, every dentist has to have an indemnity. We are insured to perform these dental treatments. So obviously, if something is, let's say, going in a different direction or unexpected problem with a patient's treatment, obviously we can speak with the patient and try to resolve it in the house, in-house, where we can try to offer some repair work to amend the issue, or to ask some of our colleagues, which are a bit more experienced, to come over and to lend us a helping hand with these cases. Sometimes when patients, they decide to have very expensive and extensive treatment in Turkey, problems might appear. Commonly we've seen chippings of the crowns or of the bridges, and that's sometimes because the bite is not properly adjusted, and then dental interferences in the bite can lead to fractures of the structure, and then the patient is unfortunately left with two options: either to contact the practice in Turkey and to go back, and sometimes it's a very laborious work, as they have to remove the entire bridge to replace it. Sometimes the patient has to pay. Obviously now is depending on how well they discuss with the practice. If the practice is, if it's a recent treatment and the practice is offering a certain warranty, and the practice is willing to cover the cost. But most of the cases, the patients, they have to cover the flights and the accommodation.
So this is the additional cost. Yes. So you have your treatment plan. So say for instance, you come across an amazing dentist in Turkey, absolutely fantastic, who had the same resources as a great UK dentist, colleagues, other professionals who could assist or fix. Even if the best case scenario was you had this amazing dentist, if anything goes wrong, again, it's the expense. It's going back to Turkey. It's going back to another part of treatment. So for my treatment in particular, I'm having 2 dental implants. I think I'll have had altogether 4 or 5 visits to the dentist over a period of 3 months. So that really needs to be taken into account when you get these prices off Turkey dentists who say, oh, £2,500, everything's done. You know, like you're saying, you don't know, is that veneers, is that bridges, that's your treatment, but you've got to continually go back to update that treatment.
Yeah, unfortunately, some of the patients, they are thinking of their teeth not in the same sense as the other parts of their body, the health, and what, you know, if you'll have a heart problem, you wouldn't go online and find the cheapest cardiologist to operate on your heart. We're not saying that Turkey doesn't have amazing clinicians. There are amazing clinicians in Turkey. I met quite a few of them over the years, and they're doing an amazing job. But those guys, they are charging approximately prices, UK prices.
I've seen a lot of variations in price in Turkey. I've met people who paid probably not far off UK prices in Turkey because, like you say, they are really good dentists in Turkey. I have met people and I've had followers messaging me with horror stories where they've paid next to nothing thinking they were getting a dental bargain, and it's turned into an absolute hell of an experience.
And unfortunately these cases are young patients who will have to suffer all their life. Vulnerable people.
People, the teeth mean a lot to people. You're a dentist, you know this. Teeth are confidence. Your smile is confidence. It's your self-esteem. It's how you feel about yourself. And I think sometimes a lot of places may tap into people's vulnerabilities around how you look or how you feel.
Because obviously if you've been, upset all your life about your appearance and you've been, let's say, a bit embarrassed to smile, or you avoided eye contact, let's say, because you're embarrassed about your teeth, and you work hard for a number of years, you have a nest egg where you have, okay, this is my money to invest in myself, in my smile, in my confidence, and then you go and you have something done, and teeth are not like your hair; they will not grow back.
You just you want your baby teeth, and then you get your adult teeth, and then
that's it. And then you spend all this money without doing the research or something like that, just based on some reviews of Instagram or Facebook and stuff like that, and you end up going, and then the reparatory work piles into the thousands of pounds. Then and truth to be told, we had patients like that who spent a big amount of money in Turkey, and they came to our practice to discuss about issues that they had with the treatment. And I will have to say, 90 to 95% of the time, patients who had problems with their dental treatment in Turkey and they came back to see us, they came to see us for investigations to check what's the problem. They said, I will never go back to that practice to have any additional treatment or to carry on with the treatment, or I will definitely consider to have everything done in UK. But that's such as life.
You live and learn, don't
live and learn. Yes,
you do.
Exactly.
So, burning question that I get asked all the time.
Yes.
Will UK, I mean, I'm not asking you to answer this on the whole of the UK, all the dentists in the UK, but generally, will UK dentists treat people who've had treatment in Turkey when things go wrong?
It's a burning question for a lot of patients, because obviously they've been with their NHS dentist or their private dentist a long period of time, and obviously they go and they tell their dentist, is depending on what relation you have with your dentist. So if you're nice to your NHS dentist and didn't shout at him too much, and you've been attending all your appointments, you tell him, look, I can't afford the treatment here in UK. I'm going to go abroad. Would you mind to check and see if everything's okay? And we've done that for some of our patients as well. Private patients who went and had all the treatment done abroad. But obviously, when you're talking about very complex work that will involve implants, root canal treatments, a lot of crowns, stuff like that, and sometimes it's problematic from the point of view where the patient comes back and they think, oh, I have individual crowns, and they are actually bridges. And then the crown, the bridge, part of the bridge chips, and then they are asking their NHS dentist or their private dentist to remove the whole thing to replace it. And all of a sudden that bill will... Private dentists, obviously, they know what to do. They have the equipment, they have the know-how how to fix these problems. Sometimes the problems might appear from the point of view where the materials are not the same. So you hear all this talk online, oh, what shade have you picked for your teeth? You know, patients who went to Turkey, what's the shade?
It's the actual, the porcelain, it's the actual material of the tooth.
It's very
so
tricky.
It's difficult to match in the UK the same as what they've used in Turkey.
Yeah, because obviously they are using zirconia. Zirconia comes in a form of a disc, and that one is being cut by a milling machine and then is sintered in the furnace to get the resistance to harden it up. We have our own lab, so I know exactly what I'm talking about. And we tested in our own lab, we tested different zirconias. So different zirconias, the manufacturers are trying to get it as natural as possible. So the manufacturers, this is the funny bit. The manufacturers are trying to get this as natural as possible with transparency, with shading and stuff like that. And the patients who go abroad, they want like
the white, that unnatural
look, like paper white, like a block white. So you have to find some companies from far away which are doing this kind of zirconia, and we have to be honest, primarily the Chinese companies that are doing this zirconia, which is very dense, very white, and it's cheap, and obviously
I know a few people, this is what I was unaware of when I started my dental treatment or looked to go to Turkey initially to get it done, was that they offer crowns from Sweden, Germany. There's difference. They offer crowns from different countries. What does that even mean? Because I was German teeth, Swedish teeth. So is that a brand, or is it that they're made in Germany, made in Sweden, or are they?
Yeah, obviously, you have companies such as Ivoclar or 3M or I don't know. Other Tokuyama, which are a Japanese company, and these companies, they are all producing. They are producers of dental equipment, dental products, and stuff like that. And yes, I can't say for sure that they are not using German products, because they might be able to use German products, but a patient will have to think, okay, if they are using German products, they will have to get them from Germany. So that means you'll have to pay a tax, or because the Turkey is not in the European Union, and they have to get import tax and stuff like that. So all this stuff, and obviously all this adds up to the cost to the patient. So you have to really have a think about
It did give me car vibes, and I don't know whether that was, it gave me Sweden strong, IKEA Volvo, I thought, is this a marketing ploy? German cars, German teeth. When they were explaining it to me, it took me to made me feel like they were a sense of reliability. The countries they were saying the teeth were from.
Yeah, I know, but
so it automatically, from a perspective from a consumer, makes you think that they're strong, reliable. But like you're saying, they could be from China. How do we know that that's actually the teeth that you're going to get?
It's very hard to know. And even if the big brand, the name of the brand is in Germany, their main manufacturer is probably in China or somewhere else, or in India or stuff like that. So we're not contesting the quality, but the thing is that obviously you have to factor in these prices, because obviously having a Swiss implant or a German implant or an American implant obviously comes with a cost. So that cost, because obviously we buy from the same place or the same kind of distributors as they buy. It's not like they have their special deals. So you have to really think, okay, if their implants are so cheap that they can offer it so cheap to the patient, where they are getting them from.
And can we not buy those as serious? Where's this market we don't know about?
I'll stop being a dentist and I'll start selling implants, But it's unfortunately, I heard cases from, it's not my case, I heard it from a friend, and basically what happened was the patient had their implants done in a practice in Turkey. They came to back home where I'm from originally. They came to Romania to carry on the treatment, They didn't want to go back for their final stage in Turkey, for the final part of the bridge in Turkey. And what happened was, when my colleague checked the implants, the labels, because you get like a label, you get your implant passport. With your implants, you get your implant passport. So when he checked the label of the implants, unfortunately, was discovered that actually wasn't
what it says it
was made on ChatGPT. The whole label and the whole barcode that was allocated, the serial number of the implants. So that was just something made up, and we have to be aware that they might say, "Oh, it's a Swiss implant," and actually it's a different brand, and they just print off the. So there are a lot of things, and I know that we were discussing previously about patients being very aware of being very worried if the practice will still be there in a few years' time. You don't know with the economical climate in Turkey. You don't know, the practice might start now. Things are going okay for 2-3 years, and then.
This is quite common. This is quite a common question with my followers, and it's also quite a common issue that a lot of followers have messaged me and said, "I got my teeth done. I went back to Turkey because there was issues and the clinic was no longer there."
The clinic wasn't there. Yeah.
I've got to say, I had at least over 100 people message me that when they went back to get work done, the clinic wasn't there, and I thought that was a really high number.
Yeah, it is a high number, and it happened. And we have some of our patients who are in the same situation, and it's problematic when they have treatment on implants.
Yeah.
And very expensive treatment that they paid. And obviously, if the practice closes, you can't do anything.
Yeah,
so from a legal point of view, you're up in the air.
So talking about legalities, I'll move that on to my next question. Is there any legal recourse UK when you're insured?
Yeah.
Again, Turkey, it's not under the EU. Is there any legal recourse if something really does go wrong in Turkey with your teeth?
Obviously, you can get like maybe like an extensive medical cover, like a travel insurance, like a health insurance for travel and stuff like that. I don't know if that one will cover cosmetic treatment. I'm pretty sure that the practices in Turkey, because you have to think from a business point of view. If they want to make money, they have to be okay, and obviously they want to. I would say probably 95% of the practice in Turkey, they want to have a good outcome of the treatment, and they want to deliver the best for the patients, because they want to be recommended and generate more business. So I don't think in their hearts they are starting out just to rip people off, So they are trying to do the right thing. Sometimes things, they don't go as planned, and usually the main problem in dentistry is time. So because everything requires time. So sometimes when things are rushed, that's when problems might start to appear and cracks might start to appear, and that's why some of the treatment require further additional treatment. Here in UK, we're going back to Turkey. But from a legal point of view, I've seen some instances where patients complained to practices in Turkey. They made like a solicitor letter and stuff like that, and they send it to Turkey. Obviously, Turkey, they are not under the European jurisdiction regarding dental treatments and stuff like that. So they can't really, not much you can do. Obviously, you can probably spend a huge amount of money going to courts, because I'm pretty sure they will have a sort of a small claims court or something like that, like an ombudsman here there in Turkey, where you can take it up further and say, but you have to look from the point of view that probably the practices in Turkey will start by saying, okay, we'll refund you the money, or we'll refund you part of the money and stuff like that. So, but the problem is that once the damage is done and they don't want to treat you anymore, they will give you, let's say you paid £5,000 and they will give you £3,000 back. But here you have to come in UK and you have to pay £30,000 to repair the problems. Then it's a problematic, because obviously if you raise a claim for £30,000, they will fight. They will fight not to pay that.
Initial cost.
Exactly. So obviously you'll have to look at from a legal point of view, where you have to speak with a health lawyer who will, let's say, be aware of treatment, abroad. Stuff like that. So probably that would be a good thing for your podcast to invite one solicitor, who deals with the international jurisdictional law regarding health, because that it's teeth, but it's also hair, it's also other cosmetic surgery, because you hear all these horror stories, and because if you remember, was a big backlash few years when a lot of UK patients went to France for their breast enlargement procedures, and it backfired, and then the NHS had to deal, and that was a big story in the paper. So you have, and it's France, so it's across the pond. But obviously with Turkey, you have to really look into it as well.
That all really runs into the choice people have got around it, because it is about personal choice, it's about financial choice, it's about the risk, the implications. So it's about what I've took from this, for me personally, is do your research. Yes, there's brilliant doctors in the UK, brilliant dentists, there's brilliant dentists in Turkey. Do your research. Don't just go off what influencers saying. Actually find out what the history of the clinic, delve into the clinic that you're getting treated on. I'd say do that in the UK and do that abroad as well. That's what I'm getting from this. Again, one thing I didn't take into account was the additional cost if you are going to Turkey, even at a great dentist. It's the treatments, the treatment plan, how many times you have to fly back out and pay the hotel, fly back out, pay the hotel. It's the length of the treatment it takes.
Exactly.
So that's
adding up to a big amount of money.
Then leads on to, if there is anything wrong, which is rightly so, which you've just said, the point of they may reimburse you £3,000 for your treatment, but that could cost £30,000 in the UK to rectify.
Exactly.
So I have gone down a wormhole really with this whole dental treatment. I know I started my series saying not Turkey teeth. The reason I called my dental journey not Turkey teeth was because, and when I initially came into you, I had looked at getting my teeth done in Turkey. I was then put off by getting my teeth done in Turkey because they wanted to shave my teeth, which I think are in great, well, you've said that they're in great condition down, and it had put me off. So I'd had that initial red flag. There's lots of people who possibly aren't going to get those red flags like I did, who are going to go ahead. So it's, it's a very personal choice. If you're going to go to Turkey, do your research like you've just said.
Yes, obviously you have the decision between going to Turkey or going to UK to find somebody to help with your dental problems here in UK. My advice to all the patients is spend some money and have a checkup here in UK. Maybe not just at your local dentist, maybe with somebody with few qualifications, and get like an accurate diagnosis of your issues. Find the best treatment, and then you have to look from lifespan as well, so it's going to look okay, but are you going to be able to talk with those teeth? Are you going to be able to chew properly with your teeth? Are you going to be in pain in the next few months?
You're going to get an infection.
Are you going to get an infection or stuff like that? So get an advice from a qualified and or maybe not a qualified, but let's say a specialized professional, dental professional, and get an accurate estimate here in UK. Do your research, have a think about, say, would I be able to afford this in UK? Would it be better for me just to fly to Turkey? If something happens, what will be the additional cost?
So really weighing up the pros and cons.
Exactly.
I think what I've took from this discussion with you is 100% go and speak to your dentist, have that open conversation and communication with your actual dentist, or like you say, a specialist dentist in those areas. Get the consultation, see what you actually need to, and what you could get away with less work than what you actually think, and then go prepared to Turkey if you were going to go, if that was what you made a decision on.
And do it sooner, because the longer that you wait and the longer that you postpone all this treatment, the bigger the bill becomes. Either if it's here or either if it's in Turkey. In Turkey, obviously, they don't want complications. They don't want the patients to come back and to, do follow-ups, free repairs and stuff like that, because you know very well that they advertise that implants are for life. Nothing is for life.
So also I want to say about my journey and when I went to Turkey was they wanted to give me 7 implants. I know I've got quite a few teeth missing from the back. I didn't need that extensive work here. It was I know initially I was having the 2, and if I want any additional ones, I can have them done. I feel as if I can manage perfectly well. I can chew, I can bite. When I've got those 2 implants in, that will be enough for me. So I don't feel like I needed that 7 implants. So not everyone is going to need the extensive list of what they say.
Some things we can, that's why it's good to have this discussion here in UK, because some things is you can say to the patient, okay, this is our recommendations, like urgent things, you can have this, and you can repair this, and these things can wait a bit longer,
prioritize
differently. You don't have to, go to a situation where you don't want to see anybody, you don't see your dentist for years, and then you end up in a situation, and doesn't matter if you come if you go to UK to the dentist or go to Turkey, they will say, we'll take you all your teeth out, put implants and stuff like that. And obviously with the dental implants, the most important stuff is follow-ups and making sure that the implants were placed to start with in the right position. If you have the main thing, our main phrase is the tissue is the issue. The tissue is the issue. So if you have good keratinized tissue around the implant, that implant is going to be protected and is going to be there for a long period of time. So obviously, when you're doing things quickly, sometimes you don't get that result, and then you get compromises. But some patients, as we discussed before, vulnerable patients who are patients with low self-esteem, who never had great teeth to start with, they will say, okay, my teeth were really bad before, these ones are okay-ish, I didn't pay a lot of money, and they will sort of forget about it, and they will fall into like a sort of acceptance kind of state and just live their life like that. But it's better to communicate with your dental professional here in UK to start with. Spend a bit of money just to investigate what are your problems here in UK, and then if you think, okay, it's a big bill, then okay, you can look at options, but really do your research.
I think that's really, really great advice, because people are always going to go to Turkey. They're not going to go. So I think the best advice for people is, like you say, speak with your dentist at home, have that conversation. If it is too expensive, then do your research, go and have a look.
And that's probably the best advice that you can give to patients, and encourage them to really do their due diligence before going ahead, because it's an irreversible process and it's life-changing.
It is, but I also found that in my mind, I thought the dentists in the UK would be a lot more expensive than they actually were. So a lot of people don't even realise the cost of the stuff that they probably may or may not need doing in dentists without having, and they just go, I'll go over there, it's cheaper, because...
obviously COVID was a big test where a lot of dentists decided to go private, and comparing to, let's say, 15-20 years ago, there are way more dental practices, private dental practices around. Therefore, the price is more competitive. And obviously, that will attract more patients to have their treatment done here in UK at better rates. So our advice is to, ask around, here in UK, because you just spend a few hours on the phone or on your laptop, just look. Most of the private practices, they have a website and they have the price list on the website, so you can check. And then obviously, if you think, okay, I like the practice, I get a good vibe from it, the prices are reasonable, then go there, have a chat with the dentist, and see what's what.
What a great way to finish. Prevention is better than cure. Look after your health, look after your teeth, look after yourself. Goodbye.